Okay, now benzodiazepine antagonist, flumazine. Okay, it is a GABA receptor antagonist. Benzodiazepine acts on GABA receptors. So it is available in IV. Rapid onset, duration is short, half-life only 1 hour. So frequent administration is required if you want to reverse the long-acting benzodiazepines. Seizures may also result if you take it with TCA or antipsychotics. Adverse effects are dizziness, nausea, vomiting, agitation. Now other anxiolytic agents. The first one is antidepressant. Now many antidepressants are effective and if you want to treat a chronic disorder, and are also first line agents for those patients if you are of concern for addiction or dependence. So antidepressants include SSRIs such as escitalopram, paroxetine, or SNRIs, serotonin norepinephrine reuptake inhibitors such as venlafaxine, duloxetine, may be used in combination with the benzodiazepine during the first week of the treatment. After 4 to 6 weeks, when the antidepressant begins to produce the anxiolytic effect, the benzodiazepine dose is tapered. So only certain SSRIs and or SNRIs are approved for the treatment for anxiety disorders such as GAD and long-term use of these is often required to maintain ongoing benefit. You can see initiate therapy with the benzodiazepine. Okay, this is you are going to initiate the therapy such as lorazepam. Concomitant therapy combine the therapy with antidepressant escitalopram, which is an SSRI. SSRI and diazepam both are given, so you can see the effect. Then tapering is required for benzodiazepine dependency. This is the guideline. Now buspirone next. This is used for chronic treatment of GAD. It has low onset of action and it is not effective for short term as needed for acute managements. So it mediates 5-HT serotonin receptors. It also has some affinity for D2. So 5-HT and D2 receptor. So the mode of action will differ from benzodiazepine. So buspirone will lack the anticonvulsant and muscle relaxant properties which benzodiazepines were having. Adverse effect is low, only headache, dizziness, nervousness, nausea, and lightheadedness. Sedation and psychomotor cognitive dysfunction are also minimal with these. You can see here common adverse effects for buspirone, alprazolam, these two. You can see here buspirone, nausea, dizziness, headache is more, and this decreased concentration with alprazolam, drowsiness and fatigue, it's more commonly seen in them. Now next is barbiturates, next type of drugs. Barbiturates are the mainstay to treat for sedating the patients, where you need to maintain the sleep or you need to induce the sleep. Overdose is lethal. You can see withdrawal symptoms here also, and these are controlled substances. What is the mechanism? They act on GABA A receptors and enhances GABAergic transmission. The binding site of barbiturates is distinct from that of benzodiazepines. They both act on GABA A, but their site is different, binding site. So they will act on chloride entry to the neuron and prolong the duration of chloride channel opening. They can block excitatory glutamate receptors. This was the mechanism of action. And what are the actions? Also duration of action is long acting, short acting. Long acting, here it is just 1 to 2 days, and short acting is 3 to 8 hours. Long acting is only phenobarbital, and short acting are pentobarbital, secobarbital, amobarbital. Now their actions are depression and CNS. Depression of CNS, they depress the CNS. Higher doses, they will cause hypnosis followed by anesthesia. First they will produce sedation, calming effect, okay, then they will produce hypnosis, then anesthesia, loss of feeling. This is increasing dose response. First you will see only sedation, then you will go to hypnosis, and then at last anesthesia, loss of the sensation. And also they will suppress hypoxic and chemoreceptors of to CO2, or an overdose will cause depression and death. The therapeutic uses: first, anesthesia. Ultra short acting barbiturates are used IV to induce anesthesia. Second is anticonvulsant. Phenobarbital has anticonvulsant activity and can depress cognitive development in children and also decrease the performance in adults. And this is sedative and hypnotic, mild sedatives to relieve anxiety, depression, and as a sedative to assist tension in migraine headaches. They are well absorbed after oral administration. They will cross the placenta and depress the fetus and excrete it through urine. Adverse effects are drowsiness, impaired concentration, mental and psychomotor impairment. You can see here they have the potential for addiction. They cause drowsiness, nausea, vertigo, tremors, and enzyme induction. Barbiturates are enzyme inducer, so they will increase the metabolism of the drugs. Cytochrome P450. Now you can see here they will interact with the drugs. Cytochrome P450 metabolism.